So we're going to start learning about Chapter 9, the musculoskeletal emergencies. As you've already done in your last week's work, you have seen a lot of how to splint, which is a major skill that ER techs need to be familiar with. But along with musculoskeletal emergencies, not all of them need to be splinted. A lot of them will be. So you have your weekend warriors who go out and play baseball that haven't played in years and they get injured. Those people will possibly need a splint. Um, but most musculoskeletal injuries are not life threatening. Of course, there can be some that can become life threatening, and the way that we want to protect the patient as well as ourselves is to learn the 5 P's of observation. The first one is pain. And we want to note the intensity of the pain, the location of the pain, whether the type of pain. How does the patient describe the pain? Is it throbbing? Is it burning? Is it aching? The pallor. So after pain is pallor. What's the color of the extremity? Is it blue? Is it pale? Is it red? Is there blanching, different colors of skin in different areas? So pallor, what is the color of the extremity? Pulses. Are the pulses good bilaterally? Can you feel them below the level of injury? Are they the same intensity bilaterally? The next is paresthesia or paresthesia, depending where you're from. And that's neurological feelings, sensations, such as numbness, tingling, altered sensation. So if you touch the bottom of their foot, they're kind of feeling it somewhere else. So if the foot is numb, if they have a leg injury, if there's burning, if there's tingling, or again, if they can't feel hot or cold. And of course, the last, which we always want to assess for, is paralysis. Are they able to move the extremity or the affected limb? So you want to know the 5 P's, and they're pain, pallor, pulses, paresthesia or paresthesia, and paralysis. So make sure that you're aware of those because you're going to need to test those after you put a splint on. So when does a orthopedic emergency become life-threatening? And that's the complications are always an infection if there's broken skin. If you have a broken bone and there's no outside injury, you're going to have less chance of getting an infection. Of course, loss of function or more mobility, inability to move that area. Hemorrhage, and hemorrhage is a severe bleeding, and that's if the orthopedic injury were to protrude the skin. Loss of sensation, which is nerve damage. It can be permanent or temporary. Of course, you can have chronic pain from an injury. It may come and go. Some older people say, oh, I could tell the weather's changing because my knee's flaring up. And, some of us think that they're crazy, but then as you live on, you realize that the dampness, the cold can actually affect an old injury. Of course, any kind of orthopedic injury that you've had can develop into arthritis, which is just inflammation. And then in children, you want to be careful of growth plates because if they have a fracture in a growth plate, it can cause the area, the bone, not to grow. So if you have a 3-year-old who has a fracture in their humerus, long bone in your arm, all of a sudden it doesn't grow because of the growth plate and you have 2 different length arms. So you want to make sure that if the growth plates are injured, that that there's lots of follow-up for that child. The next thing is compartment syndrome, and compartment syndrome is really very frightening. I've only seen it once in my career, and it's where um, the pressure from the wound actually or swelling in the area actually impedes circulation. And it can be the cast, it can cause compression on the nerves or the muscles. So it can be swelling, bleeding in a cast so that there's fluid in the cast is becomes tighter. The cast can be put on improperly, and it's very, very serious because you can lose the limb from that. So again, continuous assessment of the 5 Ps. If the patient's all of a sudden now complaining of numbness after the splint's on, or they come back the day after the cast is on, and you see dried up blood around the fingers, and they have a wrist cast, and you can see that it kind of be thinking compartment syndrome, and it definitely is a medical emergency. Fat embolism. Fat embolism is a high mortality rate. What happens is a piece of fat from a fracture actually gets into the bloodstream, and it moves into the heart, into the lungs, and it is very, very fatal. It can block off any blood vessel. It can get lodged in the lungs. It can lodge in coronary artery. Of course, shock. If you have multiple trauma, you can always have a problem with shock. So we want to avoid that and keep patients warm, keep talking to them, and hopefully avoid that at all costs.